So today we're going to talk about the anatomy of the shoulder joint. When we talk about the anatomy of the shoulder joint, we're going to discuss first the bone. Second, we're going to discuss the ligaments that hold these bones together around this joint. And third and lastly, we're going to talk about the muscles around this joint. So first, this joint is made out of 3 bones. It's made out of the clavicle, made out of the scapula, and the head of humerus. Let's take each bone and identify a couple important landmarks on each bone. So the clavicle has 2 important landmarks concerning the shoulder joint. So first is the acromial facet, and this is the part of the clavicle that attaches to the scapula through its acromion process to make the acromioclavicular joint. Joining them is the acromioclavicular ligament. Secondly, the second important landmark on the clavicle is the conoid tubercle, which connects. Here is the site of attachment of the conoid ligament that attaches the clavicle to the anterior process of the scapula that's called the coracoid. So the clavicle has 2 landmarks that attach to 2 parts of the scapula, a posterior process and a anterior process. Here is the posterior process, which is the acromion process, and the coracoid anteriorly. Secondly, we have the scapula. Important parts and landmarks on the scapula are here as we saw the acromion here, which is a process that is posterior on the posterior side of the scapula. And here we have the coracoid process, which is an anterior process of the scapula. And then we also have the glenoid cavity, which forms the cavity in which the head of humerus will join. Lastly, we have parts and landmarks on the humerus that are important in the shoulder joint. First is the head of humerus, which fits into the glenoid cavity on the scapula. And then we have the lesser tubercle, which is the attachment or site of insertion for the subscapularis muscle, which is one of 4 of the rotator cuff muscles. And then the other 3 of the rotator cuff muscles will have insertion points on the greater tubercle, which are the supraspinatus, infraspinatus, and the teres minor. So 3 of them, they insert into the greater tubercle, and 1 of them inserts onto the lesser tubercle. Lastly, between the 2 tubercles, we have the intertubercular sulcus, and here the tendon of the long head of the biceps brachii will run into the joint capsule, and actually this is the only tendon in the body that travels into the capsule of a joint. Now onto the ligaments that stabilize this joint. First, we have here, if you remember, this is the conoid process of the clavicle, which attaches the conoid ligament, attaches the clavicle to the coracoid process. There's another ligament as well that attaches the clavicle to the coracoid process, and this is the conoid ligament, and this is the trapezoid ligament, and together they're called the coracoclavicular ligaments. Okay, then we have another ligament attaching the scapula with the clavicle, and this is the acromioclavicular ligament. Then one ligament attaching two parts of the scapula, which makes a superior arch over the joint, and this is called the coracoacromial ligament. Okay, now here are three ligaments that stabilize the shoulder anteriorly, and these are the superior, middle, and inferior glenohumeral ligaments. Is unique, and as you can see, the inferior glenohumeral ligament is a little bit redundant, a little bit loose, so that there is space to move the humerus upwards when we move our hands upwards. Now onto the muscular part of the joint. Now we said we have 4 rotator cuff muscles, 1 anteriorly and 3 posteriorly. The anterior one is the subscapularis, which attaches to the lesser tubercle, and then posteriorly we have the infraspinatus, and then the supraspinatus, and then the infraspinatus, and then the teres minor, which respectively attached to the greater tubercle of the humerus, right? And then we have here the biceps. It's not part of the rotator cuff muscles, but the long head of biceps, the tendon of the long head of biceps, is intracapsular and is part of the joint of the shoulder joint. So it's so we mention it. And then the short head of biceps, it inserts into the coracoid process of the scapula. So the tendon of the long head is intracapsular, the short head attaches to the coracoid process of the scapula. Okay, right, so let's talk about the stability of this joint. This joint is a balance between stability and mobility. We have structures that stabilize and prevent the joint from dislocating superiorly and anteriorly. So superiorly, we have bony parts that prevent it from dislocating, like here the coracoid process and the acromion process. And then we have tendinous elements that stabilize as well, like the supraspinatus tendon right here, as well as the long head of bicep tendon, right? So we have 2 bony parts, coracoid and acromion, and then 2 tendons, which are the supraspinatus tendon right here and the tendon of the long head of biceps. And then anteriorly, we also have the 3. First, we have only tendons and ligaments. First, we have the tendon of the subscapularis, right? And then we can hide it to see the 3 glenohumeral ligaments: superior, middle, and inferior. While on the back side, we do not have ligaments. We only have tendons, and this adds to the mobility of the joint from posterior, because we need to get our hands forward, but we don't need to get our hands backward. We don't work with our hands backward. So we don't need our shoulders to move backwards or hands to move backward. So we have stability on the interior part of the joint, but posteriorly we need flexibility and mobility. So there are no ligaments on the posterior side, but there are tendons that can stretch, like the tendon of the infraspinatus and the teres minor, that can stretch and allow our mobility in this joint. So in this video, we have revised and looked at the anatomy of the shoulder in 4 points: bones, ligaments, muscles, and then stability factors.